Advocacy Action Guide launch webinar. My name is Eliana Monteforte, and I'm the Director for Special Projects at Global Health Council. And at Global Health Council, we work really closely with our members, our advocates, our implementers, policymakers, and many other partners to advance global health priorities worldwide. And at GHC, we truly believe in the collective voice and the power of the collective voice. As such, we bring people together at the country, regional, and global levels to share knowledge and information, network and align, and mobilize advocacy efforts on key global health priorities such as global health security, health equity, multilateral engagement, and US leadership in global health. So to GHC, advocacy is incredibly important. First, to make sure policymakers are making policies, programs, and investments that directly meet the needs of the populations they serve. And secondly, to ensure policymakers and other stakeholders are acting on their commitments to ensure health for all. So whichever your approach is, advocacy truly makes an impact. Strong collective global advocacy can lead to commitments and resolutions and international laws that support all people and their right to health. And then regional and country level advocates ensure that those commitments and values are reflected in regional and country level health planning and budgeting. Inversely, strong country and regional level advocacy impacts how governments prioritize and commit to global health initiatives. So whichever level you find yourself advocating in, you can make a difference. And guides such as the one the incubator will be presenting to you today can help you set objectives, build partnerships, develop strategy and messaging, continuously improve your campaigning, and truly influence decision-making. So I'm very excited to participate in this session today as moderator. Before I begin, I will provide a quick overview of what we will present today. So the webinar will provide first an overview of the Advocacy Action Guide by the incubator, where we will also hear from advocacy experts from the Caribbean and Nigeria. We'll also provide a deep dive into Advocacy 101 and allow for some question and answers from you. So before we get started, I wanted to go over a few logistics. Today's webinar is going to be recorded, and the recording and the PowerPoint presentations will be shared after the event. We currently have interpretation available in French and Spanish. To access the interpretation, you can click on the globe icon at the bottom of your Zoom screen, and then you can select your language of choice. Throughout the webinar, you're welcome to submit your questions in the question and answer box. So this is separate from the regular chat box. If you look at the bottom of your screen, you can see a Q&A bubble, and that's where you want to click and select your questions. So please note, if you put your questions in the regular chat box, they may be missed. We'll look out for some if they get slipped in there, but please do your best to put them in the Q&A box, and we'll try to answer as many as we can, whether it be live or in the chat. So with that, I'd like to begin our program, and I'm going to start by introducing our three speakers for today before I give them the floor. Our first speaker is Shani Winterstein, who is the Director of Capacity Strengthening and Training at the Incubator. Shani works across the incubator's portfolio to collaborate on program-wide capacity strengthening strategies, map local partners' needs and strengths, coordinate skill development programs, and monitor progress. She has over 20 years of experience in the global development sector, focused heavily on issues of community engagement, public participation, and governance. So Shani, welcome. Next, we have Rachel Morrison, who is the Senior Advisor for the Caribbean at the Incubator. Rachel Morrison is a development specialist with over 20 years of experience working on public health programs. She's currently the Senior Advisor for the Caribbean at the Incubator. And in her role, she provides strategic guidance to food and nutrition program grantees based in the Caribbean and facilitates targeted technical assistance. She also leads capacity strengthening strategy and support for grantees in the region. So Rachel, welcome to you as well. And lastly, we have Emmanuel Al-Hassan, who is the Nigeria coordinator at the Incubator. And Emmanuel is Deputy Director of the Incubator's Immunizations Program and Nigeria Coordinator for the Prevent Epidemics Program. He works with various stakeholders to advocate for improved and sustainable funding for epidemic preparedness and other policies related to health security. He has prior experience working with the corporate private sector, government, and international development partners, including USAID and DFID. Emmanuel, welcome. So I'm now going to hand it over to Shani to provide an overview of the advocacy guide. So Shani, I will give you the floor.
Hi, everybody, and thank you, Eliana, for that wonderful introduction, and welcome, everybody. We're very excited to have you here today to be part of this launch of a very exciting tool that we've developed over the last couple months. And this tool is created ideally for public health advocates, really responding to constant requests that we receive and we engage with in the sector on how do you do impactful policy advocacy. And so we drew from our experience, being part of the passing of over 80 public health policies in 40 countries around the world, to draw out the best practices and lessons learned and really try and figure out how can we provide guidance in real world settings that is very actionable. So we undertook a massive survey with all of our staff and partners, trying to draw from them their best practices. And we worked with a group coalition of experts within our organization to flesh out key concepts and actions that were common to successful campaigns and distill it into something that was accessible. Advocacy can often feel incredibly overwhelming. There's a lot of actions happening, sometimes at the same time. And we needed something that clarified the various steps and a practical breakdown of how you would go about in a systematic way to not only do the advocacy, but plan for the advocacy and then follow up on your advocacy. So in this consultation and discussions that we had within the organization, we identified 4 phases to what we see as health policy successes. Our first step is analyze, and after we get some wonderful explanations from my colleagues in Nigeria and Jamaica, we'll go a little bit more into depth on each of these phases. But our first phase is analyzing the environment, the context, and using that to then guide what would be your planning. The second phase, Christy, we can stay on this slide because we'll go through the next batch in the second tranche. The next phase is collaborate, which is really a cornerstone of the success that we've witnessed in our work. The collaboration with other partners, with decision makers themselves, with communities, and using that collaboration to create plans. The next step is actually where the rubber hits the road, I like to say, where we actually do the advocacy. And we identify 3 specific audiences that we engage in, and we'll go a little bit more into that detail. And then lastly, something that we all know too well, that once a policy is passed, that is definitely not the end of the road, that there's a lot of work to do to sustain that policy and make sure it's being implemented and is being effective in the manner we had deemed it to be. So those are the 4 phases of our health policy, and we're very excited to share this with you, and we think GHC is a wonderful platform for us to share this resource. We also included in the guide a lot of examples of where this has worked and some of the challenges that partners have faced in implementing their advocacy. The toolkit, the action guide, includes templates and those examples so that it's easy to use and effective. And you can find it online, and we'll drop the address to access the action guide into the chat itself. So now I'm going to take a moment to hand over to my colleagues who are going to tell us the reality of how this plays out in the work that they do. So I think, Rachel, you're first up on our list. Over to you.
Thanks so much, Shani. Hello again, everyone. Advocacy is essentially a discipline, one in which many of us who work in public health kind of get thrust into head on. And for us to look at a successful advocacy campaign, we often find that you need a variety of different skills and skill sets, right? This can include research, legal, communications, political analysis. So essentially creating this multidisciplinary approach. The advocacy process has multiple entry points for the incubator, and each phase is different and involves a particular set of actions. In the Caribbean, while working on the food policy program, we had the good fortune to be able to collaborate with partners very early in the process, analyzing the policy environment prior to getting their advocacy campaign started. And what this meant was that we were able to support them in creating activities that were contextualized to our region and were based in reality and easy to implement. In Barbados, when we had strong opposition, and it arose in relation to the SSB tax. So the SSB taxes were increased by the government from 10% to 20%, 20% being the WHO recommended threshold, the minimum recommended threshold. Our coalition partners had to kind of rally and work together to prevent and counter industry from trying to bully the government into rolling back the tax. And this was done through networking with using their various champions and different partnership organizations. We also had the experience at times of this never-ending, what can seem like this never-ending advocate phase, right? The regional front of package labeling process, which has been going on for the last 5 years, is a very real example of that. And partners have continuously had to find new ways of influencing decision makers, building public support and countering industry, who, let's face it, are very, very skilled at stalling processes. Recently, they have tried to make recommendations that would delay the process of getting this standard developed and established even further. And so what we found is that they're currently in the process of trying to re-strategize and think through how they can continue to regain public support. For many health policies, it's really only after a number of years of advocacy where we finally enter phase 4, which for me is one of the most underappreciated aspects of the advocacy process, right? So in defending the school nutrition policy in Barbados and also some of the initial gains in Jamaica, young people were engaged and led in sustaining policy gains and even identified new opportunities for strengthening the existing policies. And some of these were linked to things like school procurement. So looking at homegrown school feeding programs where you would have school gardens being created that were based in those particular schools, making it easier to access some of the raw materials that would be provided for the meals. Another thing that they identified was trying to think through things like quotas for fruits and vegetables from locally sourced farmers. Essentially, at each phase, what we found is that there's this process of continued assessment and reassessment, and each phase has its value. And the toolkit itself, or the action guide, basically takes you on a journey. And no matter how challenging this journey is, the guidance provided by the case studies and templates have been most appreciated by advocates working in my region, and essentially have helped to support things like their planning processes and implementing activities. So from where we sit, it essentially is something that can support advocates no matter which phase you're in or where you are on your advocacy journey.
Thank you so much. I'm sure we'll get to some questions after, but I love hearing first that this guide is truly something that's been created based off of experience, which is, I think, really critical, and love that it has case studies, because I think it's one thing to understand things in theory and another thing to really understand how it actually happens on the ground. So loved hearing those aspects. And of course, we all know advocacy doesn't end once you win whichever policy you were trying to get established, whether it's in your country or your region or even at the global level. You have to really make governments accountable for those policies and those commitments and make sure that they are actually applying them correctly and that people are actually aware that they exist and that they have those rights. So, great that you have so many resources within this guide to address those. I am going to hand it over to Emmanuel to give us some examples from Nigeria.
Thank you very much indeed. And yes, advocacy is not a sprint. It's much more than a marathon. And it is something that requires a lot of a lot of perseverance, a lot of engagement. And we have been blessed to have had good successes here in Nigeria. Part of what we did was, of course, to ensure that we enlisted the right stakeholders. It's important to do a sort of political economy analysis after identifying your policy issue. What exactly do you want to achieve? The decision makers, who are those who have power and influence? Who are those that also have interest? And who are those that have influence, but they do not have they have interest, but they don't have influence. And there are those that have influence and are against whatever it is you want to do. These are different stakeholders you need to analyze and you need to identify. And then you enlist the right stakeholders to work with. And for instance, in Nigeria, we were able to identify members of the parliament. We call them National Assembly members here at the national level. We have the Senate. We also have the House of Representatives. We're able to identify lawmakers who are very interested in what we wanted to do and also what influence. We also identified potential threats, potential groups that were going to be against what we're going to do. And I want to specifically talk about the fact that apart from one or two policies, we also did advocate for increase in funding, pandemic preparedness and response. And that was budget advocacy. We identified existing coalitions. For instance, at the national level, we identified the Health Sector Reform Coalition, a broad-based, very strong coalition of advocates, of organizations, civil society organizations, that have been playing in the health sector and that are very influential. And we're able to engage with them. We're able to build capacities of partners, other partners that we identified. So, for instance, we have Listel that we work with, the local NGO. We also work with budget at a point, and we also work with the Nigeria Health Watch. Nigeria Health Watch is very, very strong in media advocacy. These are local partners, and of course, our approach is to ensure that advocacy is locally led, and the engagements are robust. They take into consideration the political landscape, the cultural landscape, the legal landscape. And so, very importantly, we identify these people. And for instance, with Nigeria Health Watch, we're able to build capacity of journalists to engage, do stories to support advocacy for increases in budgets for health security and for the ministries, departments, and agencies that are engaged in the national action plan for health security implementation. The other thing is engagement with the policymakers. There was a time we had a challenge with the Nigeria CDC being pulled out of the Basic Healthcare Provision Fund. And that was something we had to engage through partners, through the Health Sector Reform Coalition, to advocate to the minister, to advocate to the government officials were part of all this, and were able to achieve successes. And so at the end of the day, for instance, we were able to achieve, an increase of over 100% within the space of 3 years for the Nigeria Center for Disease Control, and also significant increases for the other departments and agencies working in the health security space. These are some of the things that we have done in Nigeria, and I'm happy to share further details during the Q&A session. I think I want to turn it over to you now, Eliana, and thank you very much.
Thank you for really demonstrating how important it is to do the proper stakeholder and power mapping to know who your friends are and who maybe some people that might throw some challenges at you will be, also important when you're developing your messaging. You want to know who you're talking to and who you're trying to influence. And depending on who those target people are, you have to change your messaging and tweak it so it's something that they'll respond to. So great examples. I think before we get to the Q&A, I'm actually going to hand the mic back over to Shani, who's going to do some polling questions to get us warmed up. Shani, back over to you.
Great stuff. Thanks, Eliana. So I'm going to quickly cheat and go back to my intended plan, which is to take you a little bit through the actual Advocacy Action Guide and show you how we applied the learnings that Rachel and Emmanuel have just shared into something that kind of is systematic and easy to flow. So Christy, if you could grab those slides up for us again. So as I said, we have 4 phases, and across all of our phases, we have cross-cutting elements, and there are 4 of them. It's communications, it's research, it's legal, and it's monitoring and evaluation. And those are 4 components that at the incubator, we consider key in every single advocacy effort that we do, specifically because we focus on policy change. So next slide, please. In the sphere of analyze, we identify 3 key steps. Conducting a landscape analysis. I can't tell you how many times we've talked to partners who are just super eager to get into the advocacy, but don't have enough of the context of how is this playing out in the country. So we identify some key elements of a landscape analysis that you should try as best to answer before you even move forward with any advocacy. And based on that information, that evidence, that data, that context, you then set your policy objective. What is within the context of your analysis, what is realistic in the country in the next year or 2 to be able to achieve in terms of a policy outcome? And so we encourage you to identify smart policy objectives in the work that you do. And then you go back to the drawing board almost and you map out to achieve that policy. What is the pathway that you need to follow to engage in the decision-making process to influence it? And so we call this assessing the policy decision-making pathway. And it's a collaborative analysis that applies the specificity of your policy objective to this broader landscape analysis. The outcome is a political mapping based on research and evidence, as well as the policy and legal processes that also identifies the relevant stakeholders that you need to be engaging. The next phase, phase 2, is really kind of where you need to be thinking about who do you need to be reaching out to engage on this policy pathway. And so it was fascinating. We did a survey of our staff globally and asked them, what are some of the key components of advocacy? And the number 1 response that we got back was collaboration, that you cannot do advocacy by yourself sitting at your desk, that you need the engagement of others to truly be effective in the advocacy work that you do. And so the first thing you do in Collaborate is you look for partners and champions that will help, that have perhaps a common policy objective, that have access to decision makers in that pathway that you've identified. And you work with them to develop a strategic plan. And that plan outlines the milestones, the activities, who is responsible for the implementation of that. Hand in hand with any advocacy plan is a strong communications plan. How are you going to communicate this message, both to the broader public to make sure that you're building political will, but also to individual decision makers, all of which have different motivations for taking action? And so what we aspire to is co-creating advocacy strategies, which include strong communications. That all fits into the next phase and informs the next phase, which is, as I said, where the rubber hits the road. You actually go out to advocate. And so you can see this expansive amount of planning, strategic planning, that needs to happen before you even start with your work. Having said that, we know that you're going to be talking to many of these audiences while you're doing that analysis and that planning. So in Advocate, we try and provide some very specific guidance on when you're engaging decision makers, what are the kinds of questions you need to ask yourself to truly respond to the individual identities of those decision makers, to engage with the process, to be able to respond to their interests and needs in a way that helps you move your agenda forward. I always tell people, you never go to the Minister of Finance with the same message that you have for the Minister of Health. They have different missions and objectives, and you need to tailor your ask in a way that brings those actions together. The second audience you really need to be thinking about is the public. If they do not think your issue is a priority, it's going to be very hard for decision makers to then say, this is a national priority for us. So engaging communities, engaging the public in creating awareness in many cases of what is the problem and what is the potential solution, and supporting the public to be stakeholders in this national conversation or subnational community-led conversation. The community does not prioritize the issue, it's going to be very hard for the decision makers to prioritize it. And then lastly, countering your opposition. And there is a spectrum of opposition from those that are just, it is not a priority for them. So they're not going to help take action, or they think it's a distraction from their priorities. And then lastly, those that just straight out are opposing your issue because they have their own interests at play. And so the guidance provides some outlines of how to analyze who the opposition may be to your objective and how to prepare to counter that opposition. Ultimately, the outcome we're seeking here is action. Action from decision makers to pass and implement policies that are supported by the public and free of opposition influence. And hopefully by the end of that, you have some policy change. But as we know, and we've said, that is not the end of the road. And really making sure you're preparing from the onset to take that work forward. And so phase 4 for us is sustain. How do you monitor the implementation of the policy that has been passed? How do you make sure that it goes from potentially legislation or regulation into action? What is the guidance that needs to be put in place? What are the resources that need to be allocated to truly implement that policy? We have often found in our experience that the policies will continue being challenged even after they are passed and they are being implemented by competing interests or those who don't think the policy is being effective enough. And so the actions that you need to consider in your work to defend that policy, and that can be legal action, defending it in court. It can be about creating public awareness around the effectiveness of the policy so that, again, public support exists for that policy, and somebody will pay attention if that policy gets taken away and stand up and say, no, we think that's an effective investment of our resources. And all of those actions will then help you refine your campaign and refine your advocacy to be able to address that sustainable implementation of the policy, aspiring to policies that are maintained and improved, supported by sustained advocacy. And so that takes us through our 4 phases of our Advocacy Action Guide. And really the ambition that these phases are supposed to, while giving you structure, also give you a sense of flexibility. We always say advocacy is a 50-50 game of proactive and reactive. And so the guide, while it seems like it's a very systematic stepping stone of planning and implementation, we totally recognize that sometimes you're at a situation where you have to go back to your analysis. You have to go back to your partnership and reassess and reframe that. So within this action guide, we hope we have given you some ideas, some inspirations, some flow in terms of when you collaborate with others on how to pull together advocacy campaigns. This is designed for national level, at subnational community level, and it includes, as we said, specific templates and ideas, but you're welcome, and we encourage people to build on that as a foundation and to really let us know how you're interacting with this action guide. So sorry, Eliana, it was a little bit of a detour before we got to the polling questions, but happy to move on to our polling questions now that we've given you all the taste of what is included in our action guide. So here are the polls. And so based on that very quick overview, we wanted to get a sense from you, which phase of this advocacy process do you think is most valuable in your work? And which phase are you most comfortable with? And then you need to scroll down because we snuck in a third question. Which phase do you find most challenging? This is often kind of part of the challenge of advocacy, is we can do some of these pieces of work, but we don't always have the tools or the experience or the insights or the ideas or the resources to do all of them. So which one do you think is most important? Which phase are you most comfortable with? And which phase do you find the most challenging? We'd love to hear your thoughts on that. We'll give folks a few more seconds to respond to the poll. And then let's see what your response is. Excellent. So I don't know if everybody can see the results of the poll. Can you see those, Ilya?
Yep, we can see them.
Excellent. So analyze, I mean, it makes me so happy that we're using like evidence-based contextual understandings to inform all of our advocacy, and we see the value in that. I think that's excellent. Which are you most comfortable with? The analyze, which is really interesting. And I'd love to get Eliana and Emmanuel and Rachel's thoughts on some of these responses, because sometimes we don't know how to move from the analysis into the action. Because it's, you know, sometimes the spheres of control and analysis are much easier to manage than in the action. And of course, I'm so sad to see, but it is so true. The phase that's most challenging is sustaining the policy for many, many reasons. So let me hand back to everybody else on the panel just to get their reactions to those questions.
Well, I'll get started. I'll take moderator's prerogative and just say, it doesn't really shock me that maybe in this point in time, and analyze is something that people are really focused on. When you think about how many elections are happening this year around the world, there's a lot of change that's happening in a lot of places. And some of those countries are the most, populous countries in the world. So there's a lot of analyzing that needs to happen to see, what are those changes going to be? What does that mean for existing policy? What does that mean for policy that you've been trying to push for a very long amount of time? And, maybe doing new, you have to constantly do stakeholder mapping, especially when there's political changes in your country, to, see who your new influencers are and who are those people that, might not be supportive of what you're trying to push in your country or in your region. And so given all of the transition that's happening around the world, I can understand why analyze at this moment in time might be people's priority. So that was my immediate reflection when I saw that, but I'm happy to also hand it over to Rachel and Emmanuel to just reflect on the poll questions. And thank you for the participants for participating in those. Maybe
so
Rachel,
I think over. Yeah, so I think I had a similar reaction in terms of analyze being more comfortable for persons, just because you always, sometimes as advocates, you're always in this constant process of analysis, because of shifts, because of changes, because industry, you're trying to counter. So you're comfortable with analyze because you keep having to do it. So that was my kind of first reaction to that. And then in terms of, the sustain phase being the most challenging, it really, I think one of the things with the sustain change is also that it also tends to then bring out new things that need to be corrected, and adjustments to the policy, or you may identify from just what you assumed was a great policy win that, oh, we have all these gaps left. We actually need to push harder for legislation quicker than we thought, because we absolutely need to deal with this issue of marketing in the school environment, as an example. So, I think that's why, the sustain just feels like sometimes very overwhelming for advocates.
Emmanuel, any reflection?
Yes, thank you very much. Analysis is very, very key. And Eliana, hit the nail on the head. Right now, for instance, we have some of our leaders of government agencies that have been replaced. And so, for instance, for the Nigeria CDC, the new Director General has been having some strategy sessions. He's trying to understand what he meant. He's trying to set a new direction for the organization. And so now that is something that advocates need to understand. They need to analyze who the current gatekeepers are. We have a Minister of Health, for instance, who is not yet up to a year on the saddle. He has new aides. We have new directors shuffled, and all those analyses are very important. And understanding the gatekeeper is very important in planning, how you need to move. I also saw that advocacy scored higher than collaborate. And yes, I do understand that, of course, sometimes some of the advocacies that you engage in are really those that you need to draw on your networks. You need to draw on previous relationships. Those are very key. There are quite a number of significant one-on-one advocacy engagements, that are quite helpful. But I want to stress that identifying like minds, particularly for CSOs, is something that is very, very key. It's something that we all need to look into very well and to prioritize. Sustainability is that stage where there is some sort of a burnout, there's some sort of, oh my goodness, I mean, we've come here and then something different has happened. There's a change in government, and maybe one minister is taking us right way back. And that is why it's an iterative process. And that is why advocates also need to really build certain skills in ensuring that you are in there for the long haul, and you are able to sustain the successes that have been achieved in the past, even though at times certain things happen and it would seem like there's my thoughts. Thank you.
Thank you, Emmanuel. And I might actually ask you to answer this next question. And I'm focusing on this question because we're talking a lot about how do we go from the analyze step to the action step to the advocacy step? Like, how do we jump in? And there's a question from Vincent Odudo, who's the founder of Kapangba Foods on Wheels, provides some information about what the organization does, but I'll go directly to the question, which is, how can they engage global health and policymakers in Nigeria to partner with them on the work that they're doing? So how do you take that initial step from, we've done our analysis, we know there's a need, we have something to offer, where do you go from there? And I mean, this is maybe specific to Nigeria, but also Rachel or Shani, if in general you have a response to how you make the leap, I'll hand it over to you all too. But Emmanuel, let's go back to you.
Thank you very much. And question, how you then proceed from all your plans and the strategies that is a an important next critical step to take. And so what we did here in Nigeria was to figure out the types of key decision makers were to engage with, figure out the best mode of engagement. You also would need to do some further analysis to understand the particular individual that you're going to meet with. For instance, we've had cause to meet with a particular senator who preferred out of office meetings. He preferred meetings in the evenings. Understood that, and then we now, in terms of scheduling our visits or our meetings with him, ensured that we sort of tailored the time to him. There are a lot of different activities, that we use to engage. We're advocating for. One of them was the use of things like media parleys, getting them to engage with the media, and of course, it's important to understand for me, to whoever you're going to advocate for, and to answer that question ahead. Talking to a House of Reps member who will understand that he wants to demonstrate that he's doing his work. You want to understand that you want to let him know that you are trying to support him to further his political career, to further his legislative duties, and you're going to frame your conversations, around all of that before you even go to the main advocacy point that you want to engage with him on. So that is very, very important. And that is a good starting point. And then understanding their preferences in terms of the kind of engagements they would like. Most politicians want to be in front of cameras to talk about, the good things they have done and the things they also want to do, in addition to whatever it is that they've done before. And so we've used breakfast meetings, we've used policy dialogues, we've used media parleys, in terms of engaging with them. Now, you also need to understand that it's a dynamic situation, and so you shouldn't let your ideas and strategies be cast in stone. Usually, opportunities present themselves. I remember that when COVID broke out, in China, we were sort of very proactive. We brainstormed, and we thought it was important, for the lawmakers to do a field trip to the busiest airport in Nigeria, which was in Lagos, and also the busiest seaport, and we organized coverage, media coverage, national television stations, newspapers, and the like, to cover that, that field trip. And guess what? COVID walked right through that airport just about 10 days after that visit. And that's something that the one or two of the senators keep referring to. So that was an opportunity that we were able to take advantage of. And there are several other opportunities, that come up that way. The other thing is
So I will let you
citizenship.
do one more example, and then I'm going to move over to some of the other speakers.
Okay.
Thank you. Go ahead.
So one more example will be citizenship engagement. And for instance, Nigeria Health Watch has engaged social media influencers, because as you do the advocacy to the policy and decision makers, you also need the public awareness. You need also voices from the public, in the media space, in the public space, to ensure that whatever you're advocating for is right there in the front runner. Thank you.
Thank you so much. I mean, definitely get to know who you're talking to is what really stood out to me in what you're saying. So that great examples. Rachel or Shani, anything you want to add about how you make that transition from analyze to taking action before we go to some of the other questions?
Yeah, I can do it very quickly. So I grew up in the 80s, and one of my favorite TV shows, the line from it was, I love it when a good plan comes together, right? So for me as an advocate, I find there's a lot of value in sort of sitting down with partners and working through the planning process, where you set your goals, objectives, find those like-minded partners who can then take on specific activities that maybe your organization cannot lead on. So essentially, the whole process of planning is also a very critical element that cannot be ignored. And we actually spend a lot of time when we're working with our partners on strategic planning meetings, just to ensure that everybody is very clear about what their role is, who we're specifically targeting. A lot of that was touched on by Emmanuel in terms of the tactics of how, but all of that is based on the plan. So I would just add focusing on the planning process.
Hey, Shani, anything quickly to add?
Just to know that you have limited resources. So your decision of who to engage with needs to take into context your capacity to engage. And so mapping out that policy pathway will identify who are the most strategic people that you engage. You probably can't engage the entire ministry or the entire parliament. Who are those actors that you can engage in a strategic way, and know the policy environment? For example, meals, delivery of meals linked to health insurance, that probably needs to be within a specific policy framework. It's not worth your while just to do a blanket kind of throwing your net very wide on your ask. You need to know specifically what is the policy pathway that will help you achieve your objective in that way. And that's the strategic component that we've all been talking about.
Yeah, really great point. There is a question that might we'll have to come back to you, Shani, maybe others too, but are there going to be any add-on materials for this guide that are specific to certain disease areas like cancer, HIV? And I can already see that this guide can really be used for any disease area. It's very adaptable, but curious if you all have any plans for anything more specific.
So we realized we were recreating the wheel at guides within the organization because we were doing it disease specific. And so that was part of the ambition on this action guide. How do we create something that addresses health overall, and really in the spirit of universal health coverage and all of those objectives that we have? So we have add-ons, but they are not disease specific. We're planning to create an add-on, which will be a deep dive into the communications specific tools, one on legal, both in terms of how you design policy, but in also how do you defend it? What are potential litigation strategies? Research, how you do data collection to ensure you have evidence-based advocacy asks, but also how do you engage communities to draw research from their experiences and their needs? And how do you package that research in a way that's accessible to the stakeholders you're trying to engage? And then lastly, specifically for us, industry opposition that we face a lot in our work on tobacco control and food policy as a very niche area that we really spend a lot of our time and effort on. So we have those additions in the works.
Okay, great. So we do have 5 minutes left, and there are two very good questions that I want to get to. So the first will go to Rachel, I believe, which is how can we get young people involved in advocacy? And then I'll just let you all know that I do, in closing, want you all to think about a 30-second spiel on how can we pass down advocacy knowledge from one generation to the next. I loved that question because it's so, so important in the life of advocacy. So Rachel, over to you about how we get young people involved in advocacy, and then we'll close with your final thoughts.
So I'll say that young people, let's just start. Young people are amazing. Their energy, their vibrancy, and how they just think outside of the box. I think you have to create the kind of environment that will allow them to flourish. So essentially what that means is giving them the space and the opportunity to sit down, come up with their ideas, come up with their plans, their strategies, and to implement them. So it's really about facilitating them to be themselves. You know, we actually have various grantees who have youth groups, organizations that are attached to their wider entity, and we have a youth-specific organization. And really, most of what we've done is just kind of say, okay, what do you want to do? And really provide just, general guidance, when necessary. But essentially just allowing them to identify the issues that are most important to them and what they want to implement. So I gave the example earlier of the school nutrition policy work, and a lot of the young the organizations that we work with, their youth arms, the young persons, they have hit on the school procurement issue. Like, they grabbed into that because for them it was a very real experience coming from being in school and understanding that when I go to the canteen, I don't have any options. So how are you telling me to eat healthy when in the canteen I'm not being provided with access to healthy products? So definitely just kind of facilitating and allowing them to express where they want to go in their advocacy.
Great. And I'll actually let you go ahead. How do you think we can pass on this advocacy knowledge from one generation to the next?
I think we just have to, not be selfish. I feel like the more work you do in advocacy is the more you learn tips and tricks of the trade. And so, things like these where you have webinars where you're sharing that information and we're not kind of like, oh, we're the incubator and, we're Global Health, you don't have to talk to anybody. I think just being open about sharing strategies that have worked.
I think we just.
Yeah.
Oh, great. Thank you, Emmanuel. Go ahead.
And mentoring, very important. And one of the things that GHAI is we have a CSO Academy, and we have an RFP, and we've had responses from Africa. That CSOs to learn more. And our local partners here, Digital, and the Nigeria Health Work, some of our learnings through.
Emmanuel, for some reason it's cutting in and out, so it's a little bit hard to understand what you're saying. Let me go to Shani and see if the internet stabilizes a little bit for you, and I'll give you another few seconds because I want to hear what you're saying, but it's cutting in and out. So maybe Shani, over to you, and then I'll give it back to Emmanuel. Hopefully the internet's a little bit better. Maybe if you go off video, it'll help. Over to you, Shani.
Great, thanks. And building off Rachel, kind of sharing that knowledge, but in a strategic way. And the collaboration part is really at the crux of that, because it's about bringing in, constantly reassessing who are potential partners and stakeholders in the advocacy, and thinking about outreach to them. As you refine your campaign, you're reaching out to new stakeholders that have potentially emerged. And then lastly, added to that, we have seen huge success in peer-to-peer engagement, really kind of building off not just kind of the old school training of people in advocacy, but really bringing people together to share their lived experiences, to inspire each other. And that really has had huge impacts in people's ability to transfer knowledge from country to country, from organization to organization, and then gain inspiration. We've learned so much from our campaigns of tobacco control and food policy that inform our immunization programs and our drowning prevention. And so that cross-pollination of information ideas is vital and a key part of how we do our work.
Lovely. Emmanuel, I really want to get back to you. So let's try again.
Okay, I hope you can hear me better now.
Yes, much better.
Great. So first off, our local partners have done a great job in terms of engaging, sharing experiences with other CSOs, across Africa. Secondly, we have, for instance, on the Prevent Epidemics program, we have what we call the CSO Academy. That's a platform, that we're going to use to engage with CSOs across Africa. There's been an RFP and the response has been quite impressive. So we're going to be engaging with CSOs from at least 8 African countries. And we hope that, we're going to use that as a template to reach out to more organizations, particularly organizations with younger people. And that should go a long way in helping to ensure that this goes down to the younger generations. Thank you.
Very clear. And that's really exciting to hear. Great that you all are doing that. So I just want to thank you very much for your participation, especially to our speakers and our audience. We hope this webinar has provided you with helpful resources and information to make your advocacy stronger and more impactful. I just want to reiterate that the guide is available on the incubator's website, and I'm sure Christy's already put the link in the chat. And I did want to thank the incubator for inviting Global Health Council and myself to moderate this session today. I have been in advocacy for many, many years, and I learned something new today. So really enjoyed spending time with these speakers. And thank you again for sharing all of your knowledge and experiences. And I wish everybody best of luck in the advocacy that you're doing. Thank you.
Thanks. Bye, everyone.
Thank you,
Bye.
everybody.
Bye.